Okay, work me through this one here.
Okay, so the question is, what is the most likely outcome following discontinuation of oral contraceptives in this case? And then looking at the answer choices, rapid increase in size of the mass, multiple hepatic masses, shrinkage or resolution of the mass, progression to hepatocellular carcinoma, and no change in the size of the mass. So repro question. And then reading the case, a 28-year-old woman presents with 3-month history of right upper quadrant pain. She has no significant past medical history and takes oral contraceptive pills for the last 5 years. Physical examination reveals mild hepatomegaly. Abdominal ultrasound shows a well-defined hyperechoic mass in the right lobe of the liver. The patient is counseled to discontinue oral contraceptives. So
So,
initially,
yeah. So always start when you have these questions, right? This was what you call a second order question, correct?
right.
So you always want to start with the diagnosis. Okay, so what do you think the diagnosis is?
I think it might be an adenoma.
Yeah. So
Uh,
they give you that risk factor, hepatic adenoma is the diagnosis. Okay.
mhm.
So now, right, what do you think was going to happen?
So I think oral contraceptives contribute to hepatic adenoma growth or that those types of growths.
Okay.
So if we're discontinuing it, perhaps there would be a shrinkage or resolution.
Okay. That's your gut. So do you want to keep it or change it?
I will keep it.
Okay. Yeah, good. Okay. So 100% correct, right? But I want you to work through kind of these steps every single time, right? So you got to figure out the diagnosis, which is hepatic adenoma. Then you know that it's a risk factor, right? So from there, right, then you have to figure out, okay, what do you think is going to happen? And so actually, if you discontinue, then it often leads to shrinkage or resolution of the hepatic adenoma.